Claudine Lewis, respiratory therapy student. I'm here to talk about the procedure of drawing an arterial blood gas. Before entering the patient's room, I will gather all my supplies, verify the order in the chart, and make sure I have the correct patient. So upon entering the room, I will wash my hands and then I will don my personal protective equipment, which is safety glasses and gloves. Explain the procedure to the patient. All right, Mrs. Gonzalez, we're here to draw some blood from your wrist to see how your oxygen's doing. I understand you're a little short of breath today. So what I'm going to do is I'm going to get all my stuff together and open my little swab. Open my little swab. Oh my God. And I'm going to leave all this in the tray because that's considered cleaner than any tables at this point in time. That'll work. All right. So what I'm going to do, Mrs. Gonzalez, is I'm going to squeeze your wrist and have you make a fist. Fantastic. You can let it go. You can squeeze again. Perfect. And I'm going to let go of one side, and this is called an Allen test, and your hand got nice and pink in about 6 seconds. Fantastic. So what we're going to do is open my little swab, prep my site. Whoops. Do that again. Allen test, prep my site. Find the radial pulse again. Now this is going to hurt just a little bit, but try not to move for me because then we'll have to do it again. And about 45. Fantastic. Got a nice flash. It should self-fill. I might need to pull back just a little bit if her blood pressure is really low or she's hypovolemic. Fantastic. And there we go. Sometimes it's helpful to put something underneath the wrist so that it kind of goes that way just a little bit more. Put my needle in its handy holder, which so far has been the hardest part for me. Hold pressure. The filter on there. This filters out any excess air, which could greatly affect the values of the blood. And roll it around to mix the heparin really good. Hold pressure, hold pressure, hold pressure for about 5 minutes, longer if necessary. Make sure there's not any kind of hematoma forming or anything of that nature. This goes in the sharps container as quickly as possible. Take that off, put a Band-Aid on because she's not bleeding anymore. Fill out my label, put it on the syringe, the sample, like so. Put it in the biohazard bag, and if it's going to be longer than 15 minutes, I'll need to ice that for the analyzer. Is there anything else you need today, Mrs. Gonzalez? Fantastic. Thank you so much for being such a helpful patient. And that's how you do an ABG.